So let's walk through the bones and the important landmarks of the bones within the lower extremity. And so we'll start with the bones of the lower extremity, and we'll start with the bones that make up the pelvis. And then we get the femurs, the patellas, the tibias, the fibulas, the tarsals, metatarsals, and phalanges. So the first bones we'll look at will be the bones of the pelvis, and we have three principal bones that we'll see here: the ilium, the ischium, and the pubis. And so let's start with the lateral identifications, where we have off of the ilium, the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. Now, instead of having to write out all of the phrases here, you can use the abbreviations ASIS, AIIS, PSIS, or PIIS. In between the superior iliac spines, we will find the iliac crest. Along the ilium on the lateral side, we have three distinct lines. We have the superior gluteal line, the inferior gluteal line, and the posterior gluteal line. These are going to be muscular attachment sites for the gluteal muscles. We then have the acetabulum and the rim of the acetabulum, where we have the junction point between the three bones that make up the coxal, the ilium, ischium, and pubis bones. The acetabulum is the junction point between the pelvis and the bones of the lower extremity. To the posterior aspect of the acetabulum, we have the sciatic notch. On the ischium itself, we have the spine of the ischium, the ischial tuberosity, and the ramus of the ischium. Now, the ischial tuberosity is the bony landmark that we will be sitting on when we sit. The quote-unquote boniness of someone's gluteal region is based off of the bursa and fat pad that surrounds the ischial tuberosity and how exposed it happens to be to the integumental skin that is in that area. So that's the lateral view. So let's go ahead and look inside of the pelvis. And let's take a look at the internal structures within the pelvis. And so we'll start once again with the spines. And in between the spines, we will see the iliac crest. Just anterior to the posterior spines, we have the auricular surface. This is the area that's going to be articulating with the sacrum. And just anterior to the auricular surface, we have the arcuate line. On the ischium, we will see the spine of the ischium and the ramus of the ischium. We will see the sciatic notch. On the pubic bone, we will see the ramus of the pubis, the spine of the pubis. We will also see the pubic tubercle as well as the pubic symphysis. And then in between the ramuses of the pubis and of the ischium, we have the obturator foramen. So let's continue on now looking at the femur. And let's take a look at the key anatomical landmarks of the femur. We have the head of the femur. The central part of the head of the femur, we will see a foramen, the foramen to the head of the femur. This is what's going to allow the blood vessel to get into the head and neck region. This is the only blood supply into this head and neck region. If that gets disrupted, we will get necrosis within the head and neck region, and is one of the principal causes for the need to have a hip replacement due to fracture of the femoral neck. We get to the femoral neck. The femoral neck is the area that has the greatest amount of angulation that we see within the lower extremity. The angulation here is going to allow us to go about being bipedal and walking, and we'll get a little bit more to this when we look at the actual hip structure itself. Lateral to the head and neck, we have the greater trochanter. On the posterior medial surface, we have the lesser trochanter. Heading inferiorly, we get to the body of the femur. As we get towards the distal edge, we will get to the adductor tubercle. This is the attachment site for the adductor muscles. We then get to the medial epicondyle and medial condyle. And then on the lateral side, we get the lateral epicondyle and the lateral condyle. And then in between the condyles, we get the femoral groove. Some books reference this as the intercondylar groove. This is the area that the patella will go about articulating with the femur. So now let's look at the femur, but this time from the posterior aspect. So once again, we'll still have the head. We'll still have the neck. We'll still have the greater trochanter. And more pronounced now, we see the lesser trochanter. In between the trochanters, we get the intertrochanteric crest. And then we get two bony lines. To the lateral aspect, we get the gluteal line. And on the medial aspect, we get the pectineal line. The two lines junction together about a third of the way down the body, forming the linea aspera. The linea aspera, as it gets to the lower third of the femur, will splale out, forming into the epicondyles. On the medial side, this splaling will also allow us to see the adductor tubercle. We then get to the medial epicondyle. And then more pronounced, we can see on the posterior surface, is the medial condyle. To a lesser extent than what we saw on the anterior side, to the posterior side, we see the lateral epicondyle, and then more pronounced, the lateral condyle. Notice the difference in shape between the condyles as well as the angulation of the condyles. This becomes once again important when we look at the architecture of the knee as it relates to the ability to stand and to walk. And then in between the condyles, we have once again the continuation of the femoral groove or the intercondylar groove. So let's take a look here at the knee itself, and more importantly, let's take a look at the patella, in which we have the body of the patella, the apex, and the base of the patella. The patella is a sesamoid bone that's sitting inside of the quadriceps tendon, and actually breaks the tendon into two parts: the tendinous part to the superior edge, and the ligamentous part to the inferior edge. As we get into the tibia, the first thing we're going to see is the tibial crown. The tibial crown is made up of the plateau and tibial tuberosity. On the plateau, we see the spurs for the ACL and the PCL, the anterior cruciate and posterior cruciate ligaments.